Hi, this is Roger Green, host of the Surfing the Next Tsunami podcast. We are offering 3 conversations from this week's preview of the Digital ILC 2021. In this conversation, Professor Luca Valenti of the EASL Scientific Committee and Stephen Harrison discuss highlights of Digital ILC 2021, focusing not only on the topics to be discussed, but also the benefits of EASL's new platform, which will provide exciting opportunities for collaboration and networking. Digital ILC is one of hepatology's premier events year in, year out, and 2021 will be no exception. So sit back, listen, enjoy, learn, and when you're done, join the discussion on our LinkedIn and Facebook discussion groups.
Every week, a global community of fatty liver disease stakeholders comes together to explore the most important challenges in diagnosing, treating, and developing medications for patients with fatty liver diseases. Join hepatology researcher and key opinion leader Dr. Stephen Harrison, liver wellness advocate Louise Campbell, pricing and forecasting guru Roger Green, and this week's guest, hepatology researcher, key opinion leader, and EASL Scientific Committee member Professor Luca Valenti, as they preview the upcoming Digital ILC 2021 conference, this week on Surfing the NASH Tsunami.
Let's talk a little bit about the conference, and I want to ask a few questions, and then Steve and Louisa, obviously feel free to jump in. You say you're on the Scientific Organizing Committee. Now, what exactly is that group responsible for organizing for the conference?
Well, actually, we are involved in basically drafting the scientific content of the conference and organizing the session, the symposia, the collaborating with those who are organizing the postgraduate course and the basic science seminar, and evaluating the abstract and drafting the oral session and so on. So this is related to international, the ILC, but we are also involved, of course, in organizing all the other EASL events like the Navaly Summit, which will be held, for example, in the autumn, and it's mainly concerning the ILC.
That's great. So this is a digression. But since this is a NASH podcast mostly, the idea of the Navaly Summit is very exciting. Is there anything you can share about that before we go back to ILC?
Well, concerning the summit, this year will be organized by me with Quentin Anstey and Anneli Järvinen, and it will be especially focusing on translational research and the field of Navaly, the identification of new targets and new biomarkers for this condition. So I think it will be kind of also complementary to the ILC, and I'm very excited to this meeting, and I advise you to participate to hear the latest news in science concerning to fatty liver disease.
Well, congratulations. That's really exciting. Was there a specific reason that motivated EASL to do the Navaly Summit as well?
Well, this summit is one of the key conferences organized by the EASL. We have a liver cancer summit, for example, and we try to organize a summit related to the most hot topics in hepatology to update on the science, the drug development, and so on, and involve also the industry and the companies in the field. This is particularly focused on a specific aspect which cannot be done so extensively in general conference, which like the ILC, which presents all of the latest news in the whole field of hepatology.
So let's go back to ILC for a minute. Let's go back to ILC, not just for a minute. What is the one thing about the ILC that you find most exciting this year?
This year, we'll have a new platform compared to the first digital ILC we had last year, and this will provide the possibility to have additional features, some exciting new feature like the possibility to relate and connect with peers and personalized suggestion to specific content that you may be interested in based on your specific profile, and it will also give you the possibility, for example, to network with people working in your area of expertise and to set up meetings and so on. So I think there will be a lot of possibility of networking, even if you won't be able to be there, which will render this experience not to miss.
Will you be doing formal, I guess what they call are speed dating kinds of sessions where people just meet for a couple of minutes and talk and go from talk to talk to talk, person to person?
We are discussing it, but there will be certainly the possibility to people in dedicated virtual rooms.
In terms of the content of the meeting, are there any specific, I know you can't talk about what's in the abstracts, but we can talk about the titles and the sessions. Are there any particular topics that are going to get a lot of attention that you think people will find interesting or will want to be involved with?
I was particularly dedicated to drafting the fatty liver disease or NAFLD session, and we will have exciting data from the original presentation session, both from the NAFLD dedicated oral abstracts and the symposium as well. This year, the symposium will be mostly dedicated to the clinical management of NAFLD, both the multidisciplinary management of the disease, the advanced and therapeutic development, and the role of lifestyle management in the management of this condition. The oral communication, we will have also important novelties which will be presented in both the general session and in the late breakers, and this will be a particularly exciting session where results of both, I would say, early stage trials and late stage trials will be presented. So we will cover the whole spectrum of drug development in NASH, from the first in human studies with new therapeutic targets coming from genetics, for example, to phase 2 studies, new promising drugs acting on metabolism, and new targets to initial results from phase 3 trials, which will report the results of the drugs in the most advanced stage of development. And we will also have the new data on combined non-invasive biomarkers able to identify patients at risk of liver disease and to monitor disease progression.
Stephen, Luis, do you have any questions for Luca at this point?
Well, it sounds like a terrific agenda and a terrific group of topics to discuss and go through. There's been, as you know, Luca, a wealth of data that's come out since AASLD, and it seems like every 6 months the amount of data that comes out exponentially rises. I was just looking back on some work that we've done with Litmus, for which you're a part of as well, and just 2 recent publications looking at non-invasive markers sequentially, combining FIB4 plus FibroScan, liver stiffness to predict development of cirrhosis, and there are many others. That's just touching the tip of the iceberg. There's new data with ProC3, new data with ELF, new data with other sequential combinations of tests to include MRI plus additional clinical variables. So we're beginning to really dive into how effective these non-invasive tests are for 3 different contexts of use. And I allude to this all the time. We have to get better at diagnosing the at-risk NASH patient. I think we're relatively good at excluding disease. We're not yet there on identifying advanced disease, or where is it? Are they F2s, F3s, F4s? We're just really good at telling you don't have disease, but we're not really good at pigeonholing you into a disease category once you have been identified at risk. So I think there's work to be done there. There's work to be done on therapeutic monitoring. And I suspect, Luca, there will probably be data presented relative to that. And then long-term patient outcome measures. I think that's the other hot topic area of where we can really begin to bend the needle. And as we're able to show long-term outcome measures with non-invasive tests, that's where we have the unique ability to step forward, lean in, and potentially leapfrog liver biopsy as an endpoint for NASH clinical trials. I don't think we necessarily have to always compare ourselves to a biopsy. If we're able to take a non-invasive test and link it to an outcome, the next step is taking that non-invasive test, showing there's improvement in the non-invasive test, and linking that to an improved outcome. And I think that's where the exciting data will be generated over the next 6 to 12 months. And then the therapeutic area is one that's incredibly exciting, not only as monotherapy, as we begin to break down therapies into those that are good for cirrhosis, those that are good for non-cirrhotic NASH, injectables versus orals, those therapies that have extrahepatic benefits on liver disease, on glycemic control, atherogenic lipids, renal function, and the like will be exciting to see. And then the combination therapy paradigm is really just beginning to grow wings and take off. So just touching the iceberg on those 2 topics would keep us going for a long, long time, Luca, without even discussing other aspects of fatty liver disease, liver transplant, liver cancer, and those sorts of things. So I'd be interested to know if there's any new epidemiologic data you think that's going to be important that could be highlighted at the meeting.
Yeah, there would be, as you mentioned, and I completely agree with your point of view, this related to the biomarkers will be a very important point in the future, that the ability to correlate the biomarkers with the long-term hard clinical outcomes in the disease. And we will have data on a combination, for example, biomarkers and liver stiffness measurement that will be related to the ability to rule in the disease. We will also have epidemiological data coming from different cohorts relating the impact of the NASH, the diagnosis of fatty liver disease on mortality and clinical outcomes, which will present what is the burden of NAFLD on both the hepatic and the extrahepatic disorders and on the clinical events in the population.
Absolutely, it does. The other area that Luca spent some time in, and he also mentioned Quentin Anstey, is the area of genetic biomarkers. And, is there going to be some updates there relative to something, say, potentially like polygenic risk score for NASH? Any new data on PNPLA3 or HSD17 beta 13 or any of the more novel genetic markers, combinations of markers? That, I think there's always new data there. I would imagine there's going to be new data at EASL relative to that also.
Yeah, there would be new data on the impact of genetic biomarkers of the disease. And actually, as you say, as an expanding field, there would be data presented also on new risk variants for this condition, HSD17, which is a very important one because it will be also linked to some new therapeutic approaches during the ILC. There will be two presentations, for example, on therapeutic approach aiming at suppressing the protein encoded by this HSD17 beta13 gene, mimicking the protective effect of this genetic variant on the risk of the disease. And this will be presented during the meeting. And there will be also new data on other genetic risk variants for this condition that will possibly highlight other pathways involved in disease predisposition, which will further improve our ability to stratify the risk of progressive liver disease. And this may be particularly important in young individuals who have not yet developed advanced disease, but may be at risk in the future because of genetic predisposition and metabolic risk factors, for example.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please send an email to questions@surfingnash.com. We'll be back on Thursday, June 10th, right after the end of the International NASH Day cooking demonstration, to discuss how different stakeholders can help implement the Global Liver Institute's U.S. NASH Action Plan. Come motivated. I'm certain there will be things you can do to help. I hope you'll join us on the 10th. Until then, stay safe, surf on, see you on the podcast. Bye-bye now.